Quick question. Do your eyes feel absolutely terrible the moment you wake up, but kind of magically get better over the course of the day? Yeah, that's not actually random. There's a very good chance you're actually sleeping with your eyes a little bit open. I know it sounds crazy, but we'll break it down. Let's go. Hey, I'm Dr. C, a Double Board-Certified Optometrist and the owner of Eye Drop Shop. This channel exists because eye problems are confusing, the internet is frankly chaotic, and you deserve an explanation that's clear, accurate, and actually helpful. Today we're talking about something called Nocturnal Lagophthalmos, which is just a fancy word to say that your eyes are a little bit open when you sleep.
That's so weird.
It's something I diagnose all the time, but almost no one has heard of it. But right before we start, if you care about keeping your eyes healthy, comfortable, and looking their best, make sure to like, subscribe, and ring the bell so you don't miss any future episodes. Let's talk Nocturnal Lagophthalmos, what it actually is, how common it is, and most importantly, what you can do to help yourself.
I would love that.
Before you picture something extreme, I want you to keep in mind that when we say your eyes are a little bit open when you sleep, it can be really subtle. They're not wide open completely. It's mainly a little bit of a gap, and that can affect how you feel for the next day. Here's the surprising part. Some studies cite that up to 20% of people sleep with their eyes partially open. So if this sounds familiar, then you're absolutely not alone. This is a key pattern I want you to remember.
Okay, let me write this down.
If your dry eye is worse in the morning, improves as the day goes on, feels gritty, burning, or irritated when you wake up, that tells us that the problem might be happening overnight. See, when your eyes don't fully close, your tears will evaporate while you're sleeping because you're not blinking, there's no protection, and that's 8 hours of just constant exposure to the front part of your eye. Patients will often come to me and describe it like, my eyes hurt before I even open them. They're red in the morning. One eye is worse than the other. I try and use drops, but it only helps temporarily. If this sounds like you, then that's actually a huge clue.
I had no idea.
Here's where people actually get stuck. They're using eye drops during the day. They're doing everything right.
Did everything right.
But even if you use drops right before bed, they're not gonna last all night. And if the surface is exposed while you sleep, drops alone can't prevent that loss of moisture. So you're constantly playing catch up in the morning and throughout the day. There are a lot of reasons that this can happen.
Name one.
It could be natural facial anatomy, loose eyelids, aging changes, the way you sleep, if you've had surgery near your eyes, if you've had Botox. I mean, the list can really go on and on. How do you know you actually sleep with your eyes a little bit open?
You watching me sleep.
So the first hint can be that you wake up and your eyes are feeling very gritty in the morning. But when you come see me or your eye doctor, I put a little yellow dye in your eye and I will see a typical pattern of staining on the front part of the eye that indicates to me that this is what's going on. This is typically what I discuss with my patients. Obviously, this isn't medical advice, just education. So the first option and the easiest one is a nighttime ointment, because ointments will stay on your eye longer than a little drop. However, it won't last a full night, and my patients can still feel that dryness in the morning, and sometimes the ointment makes your eyes a little gunky in the morning. But if they're willing to clean their lashes when they wake up, this could be a good starter option. The second thing I always talk about is looking at the environment around the bed. So we don't want any airflow directly coming towards the eyes or anything that's going to be excessively hot. We want to have a nice humid environment, which is why I often recommend putting a humidifier beside your bed. The third option, which is actually really important, is actually using something that'll keep the moisture onto the eye. And this is where certain useful tools will come in. The first one we could talk about is this sleep mask from Blinkjoy. Full disclosure, the next 3 products that I'm about to talk about are sold on Eye Drop Shop. I am absolutely not endorsed to speak about these, but these are the 3 options that I present to my patients honestly, so I want to make it easy for you to know what can be some solutions if you sleep with your eyes open. The first one is called Blinkjoy. So this is a mask that you use at night to sleep. So what this does is it actually contains a little section so that if you do open your eyes a little bit at night, it'll retain the moisture in this eyepiece. So it won't evaporate and your eye won't actually be exposed to air. These can be adjusted depending on how far or how close your eyes are. So you would take a second at the beginning when you first get it to adjust this distance, and then you put it on top of your eyes, you Velcro it in the back, and then you just go to bed. Okay, so like this for you, and like this. The great thing about the Blinkjoy mask also is that it's really easy to clean. So you just remove this and you could wipe it down with hypochlorous acid, let's say. And it's also safe to use all night. So you would put this on and sleep all night with it and wake up in the morning. It's also extremely comfortable. So if you look at all the material, it really feels like something like a cloud that you put on your face and that you feel, you know, in the morning will feel good when you remove it. What's also cool is that you could buy these replacement covers if ever you want. So it's a very easy and sanitary way to keep your eyes humid overnight. And I've had so many patients tell me that this is actually a game changer for them.
Woo! Game changer.
So something simple that has no side effects, I'm on board, and that's why I really love this and I recommend it to my patients every day. It takes some getting used to be able to sleep with a mask when you've never slept with one before, but once you get used to it, then it becomes really comfortable and part of your nighttime routine. So a second option for a nighttime mask and a hydrating sleep mask is called EyeSeals 4.0, and this one is actually made entirely of silicone. So with this one, it's easy to clean, but a different level of comfort. And you would put this same thing, close your eyes, put it on your head, put this strap behind, and use it to sleep all night. Look how cool I look. So the difference with this one is you could actually open your eyes under and see if you do wake up in the night. But obviously the whole point is that you keep your eyes closed. These nighttime masks are actually great if you use a CPAP machine at night because first of all, the CPAP machine should be well fit. So that would be step one, to make sure that it's fit properly so that there's no air that escapes. But even sometimes when it's fit the best it can be fit on your face, a little bit of air escapes. And so now if you sleep with your eyes a little bit open, you have air blasting towards your eyes, which is kind of a recipe for disaster. And that's why these masks are key because they will protect your eye from receiving any kind of air from your CPAP machine or the surrounding environment. Option 3 are these little eye seals that you could actually tape to your eye to close your eye overnight. Should I try one? It comes in these packs, so there's 30 packs of 2, and essentially what you would do is peel this off and stick it to your closed eye, and so your eye will stay shut overnight. Normally I do this in front of a mirror so I'd have the other eye to see, but so you close your eye. Once your eye is fully sealed, then you'll put the tape on, and this will keep your eyes shut all night. And then it peels off easily, and obviously they're disposable. So of course this is made to put on skin. So when you take it off and you kind of feel the stickiness of it, it's a little sticky, but I mean, it really doesn't feel that much. So it will keep your eyes shut, but it won't be very hard to remove in the morning. The thing with this one though is you can't put an ointment before putting this because then it really won't stick. Whereas the other 2 masks, the Blinkjoy and the EyeSeals, I recommend putting an ointment before and then putting the mask. So you really have like the ultimate protection. By using any of these 3 solutions, what we're doing is instead of treating the problem during the day, we're trying to prevent the exposure overnight, which is exactly what people with nocturnal lagophthalmos need. If you're waking up with persistent pain, significant redness, sensitivity to light, blurred vision, these are all signs that you need to see an eye care professional.
That makes sense.
If your eyes feel the worst first thing in the morning, that is not random. Dry eye doesn't always start during the day. Sometimes it starts while you're actually sleeping. If this sounds like you, comment morning eyes below and I'll break down a full nighttime routine next. If this helps you, give it a like and subscribe. It really helps this information reach the people who need it most. I make these videos so you feel informed, supported, and empowered to actually heal. I'm Dr. C. Take care of your eyes, and I'll see you in the next one.